Hello, my name is Afif El-Khuffash. I'm a neonatologist working at the Rotunda Hospital in Dublin, and I'm a professor of paediatrics at the Royal College of Surgeons in Ireland. I am the local and principal investigator in the Aceduct Trial in collaboration with our colleagues in Canada. So the Aceduct Trial is comparing two methods of treatment for a condition called patent ductus arteriosus in preterm infants. Normally, we use a medication called Ibuprofen or Nurofen to try and close this blood vessel in preterm infants when it is likely to cause issues in their breathing. However, the closure rate with using ibuprofen is only about 50%, especially in the smallest babies. So what the Aceduct Trial is trying to see is whether a combination of two medications compared to just one medication can result in a higher closure rate of the patent ductus arteriosus in preterm infants. So the combination we are using is ibuprofen with paracetamol compared to ibuprofen alone. So the patent ductus arteriosus is a blood vessel that normally connects the two major arteries coming out of the heart, the aorta and the pulmonary artery. During fetal life, it serves the purpose of bypassing the lungs to send more blood across to the other side of the heart because the lungs are not used for breathing during fetal life. After the baby is born, normally if the baby is born at term, this blood vessel spontaneously closes over the next 3 to 4 days following delivery. However, if a baby is born preterm, the blood vessel can remain open, and in some babies it can cause some issues. Those issues include sending actually more blood to the lungs, so the flow across it reverses. So instead of it bypassing the lungs, it actually ends up sending more blood to the lungs. And the lungs of those babies can be become heavier with extra fluid. It can cause the baby to experience some breathing difficulty, and it's also associated with issues in the brain and in the gut. So in some babies we feel like closing this patent ductus arteriosus over the first few days of life may be beneficial to those babies. We can close it with medication, as I mentioned, ibuprofen. However, the closure rates are quite low, especially in the smaller babies. So that's why we are trying to see whether a combination of two drugs would be better than just one drug alone in increasing the closure rates in those babies. So the primary objectives of this trial is to establish whether the closure rates of the patent ductus arteriosus in preterm infants can increase when we use a combination of medications compared to a single medication alone. So we are comparing a combination of ibuprofen and paracetamol to ibuprofen alone, which is the current standard of care. Our primary outcome is the rate of closure of this blood vessel following the course of treatment. We're hoping to see an increase in the rate of closure when we use the combination of the medication. And we're also hoping that by increasing the closure rates that we will see better outcomes in those babies, in particular a reduction in the rate of chronic lung disease, which is a lung condition experienced by preterm babies before discharge from the hospital. Chronic lung disease can have longer term consequences on babies. Babies born preterm with chronic lung disease are more likely to be admitted to hospital following discharge with breathing problems secondary to infections, and they may experience a higher rate of wheezing over the first few years following discharge. So that's why it's important to try and reduce the incidence of this condition in the premature population. Well, this trial is actually a multi-center trial. We are collaborating with colleagues in Canada, so there are 3 centers in Canada that are leading the study, and we are the only Irish center outside of Canada actually that is also participating in this study. So it's a great collaborative initiative to try and improve the outcomes of these babies. It's important to do this study because there has been so much research conducted so far over the last 50 to 60 years on babies with patent ductus arteriosus, and unfortunately we are none the wiser as to how to improve closure rates and whether closing it can actually result in an improvement in outcomes at all. So we feel that with this collaboration between ourselves and our colleagues in Canada that we may actually come closer to this answer.